Good morning, everyone. I'm Budi, and I'm thrilled to have you here on my channel. Whether you're a student, past or present, an educator in any subject, or simply someone passionate about creating educational content for learners of all ages, you've found your spot. Together, we're going to dive deep into the exciting realm of crafting teaching materials, leveraging AI avatars to make learning not only effective, but truly engaging. Let's embark on this journey to revolutionize education for curious minds. Today's focus? A topic I can't wait to explore with you.
The next video will show an example of teaching materials created by AI avatars on the following topic.
Good morning, class. I hope you are all doing well. Welcome to another session of our English for Medical Science. In our next meeting, we are going to talk about an important topic, vital sign. This is a crucial subject in the field of medical sciences, and understanding it is essential for healthcare professionals. 1. What are the 4 primary vital signs typically monitored in both clinical and home health settings? 2. What tool is commonly used to measure oxygen saturation in the blood? 3. What do the terms tachycardia and bradycardia mean? Take your time to think about these questions. There are no wrong answers. We'll talk about it more in our next class, and I can't wait to hear what you come up with. Don't hesitate to ask if you have any questions before then. Have a wonderful day.
The next video will show an example of teaching materials created by AI avatars on the following topic.
Good morning, everyone. This is Mr. Budi. Welcome to English for Medical Sciences. You will be watching the following video. Please have a pen or pencil and paper ready to take notes on important points. After watching the video, you'll be given questions related to the content. Following that, each of you will have the opportunity to read the provided text aloud. This exercise will help improve both your fluency and accuracy in reading.
Good morning, everyone. Welcome to English for Medical Sciences. Today, I am going to talk about the crucial role nurses play in helping doctors learn about their patients. Here are a few ways nurses help. 1. Patient history. Nurses gather detailed patient histories by engaging in conversations, actively listening to patients, and reviewing medical records. They compile information about past illnesses, medications, surgeries, allergies, and lifestyle factors. This data forms a comprehensive overview of the patient's health trajectory, aiding doctors in making informed decisions. 2. Vital signs. Monitoring vital signs like blood pressure, heart rate, temperature, and respiratory rate is a core nursing responsibility. Nurses not only record these vital signs but also interpret trends and deviations, providing doctors with real-time physiological data crucial for diagnosing and evaluating a patient's condition. 3. Patient behavior. Nurses closely observe patient behavior, noting changes in mood, demeanor, or mental status. This keen observation helps detect alterations in a patient's condition, facilitating early intervention and providing doctors with insights into the patient's response to treatment. 4. Communication. Effective communication between nurses and patients fosters trust and allows nurses to gather pertinent information about symptoms, concerns, and preferences. Nurses adeptly communicate this information to doctors, ensuring accurate and comprehensive transmission of patient data, which is crucial for diagnosis and treatment planning.
Good morning, class. Today, you have watched a lecture on the crucial role nurses play in helping doctors learn about their patients. Please take some time to answer the questions related to the content. Collaborate in a group of 2 students to answer the following questions. Following that, each of you will have the opportunity to read the provided text aloud. This exercise will help improve both your fluency and accuracy in reading. Question 1. Which vital signs are typically monitored by nurses? Question 2. Which type of patient information is crucial for doctors' decision-making? Question 3. What aspect of patient history helps doctors understand treatment implications? Question 4. What is the primary purpose of nurses' constant monitoring of vital signs? Question 5. What does observing patient behavior helps nurses to detect?
The next video will show an example of teaching materials created by AI avatars on the following topic.
Good morning, class. I'm Mr. Budi. Welcome to English for Medical Sciences. Today, you'll watch the following video twice. Please have your pens or pencils and a piece of paper ready to note down important details. Following that, you must complete the patient record form. If you have any questions during the video, please raise your hand, and we will address them at the end.
Good morning, Dr. Budi. My name is Nurse Nancy and I am going to report the new patient to you. The patient's name is John Smith, a 43-year-old male who was admitted to the hospital on the 19th of April 2023 because of chest pain. The patient was born in Ontario, Canada, and currently resides in Canada. He has had type 2 diabetes since 2017 and is currently on metformin medication. John doesn't drink, but he has been smoking for 20 years, with a daily intake of 1 pack. John's maternal grandparents have a history of angina, which is a condition that causes chest pain due to reduced blood flow to the heart. Hence, John is at risk of developing angina and other heart-related conditions due to his family history and smoking habits. This report will provide an overview of John's medical history, current condition, and treatment plan.
The next video will show an example of teaching materials created by AI avatars on the following topic.
After watching the video, please pair up with a classmate. One of you will take on the role of the nurse, and the other will be the patient. Act out a dialogue set in a hospital reception area where the nurse interacts with the patient. Pay attention to tone, language, and realistic scenarios. Take turns playing each role. You have 10 minutes to prepare, and then we'll start the role play.
Good morning, Mrs. Anderson. I'm Nurse Rodriguez, and I'll be taking care of you today. How are you feeling?
Good morning, Nurse Rodriguez. I'm feeling a bit tired, but otherwise, I'm doing fine.
I'm glad to hear that, Mrs. Anderson. As part of our routine care, I'll need to check your vital signs. These include your temperature, blood pressure, pulse, and respiratory rate. Is that all right with you?
Yes, Nurse Rodriguez, that's perfectly fine. I understand the importance of monitoring vital signs.
I'll start by taking your temperature. I'll use a thermometer to measure it. It should only take a few seconds.
Okay, Nurse Rodriguez.
Your temperature reads 98.6 degrees Fahrenheit, which is within the normal range. Now, I'll measure your blood pressure. I'll wrap a cuff around your upper arm and inflate it. It might feel slightly tight but shouldn't be painful.
I understand, Nurse Rodriguez. Please proceed.
Your blood pressure is 120/80 mmHg, which is considered normal. Now, let's check your pulse. I'll place my fingers on your wrist or neck to feel your heartbeat.
All right, Nurse Rodriguez.
Your pulse rate is 72 beats per minute, which is also within the normal range. Lastly, I'll count your respiratory rate. I'll observe your chest rise and fall as you breathe.
Okay, Nurse Rodriguez.
Your respiratory rate is 16 breaths per minute, which is normal. Thank you for cooperating, Mrs. Anderson. These vital signs help us monitor your overall health and detect any changes that may require attention.
For those of you interested in designing English teaching materials using AI platforms like AI avatars, I am available to provide training at your institutions. Enhance your educational tools and engage your students with the latest technology in language learning. Hello everyone. Thanks for watching. After watching this video, please take a moment to read the disclaimer.